Okay, so I'm the CEO of the Brighton Therapy Centre. I
Yeah.
manage the organisation and I'm also one of the therapists on the team. So I also maintain a clinical practice here. You'll be aware that the NHS is under great strain, that people are experiencing more and more problems with their mental health, and the services aren't coping. And what services are available tend to be quite short-term offers of CBT therapy, a few sessions. What we do is quite different. We are working with our team are specialists in trauma-informed approaches. They're very experienced and qualified, and we offer usually longer term therapy. So something that hopefully will make a meaningful difference to people's lives rather than a quick fix. And the great challenge, we know that works. We know it makes a significant difference to people, but it costs money if we're going to do it properly. If we're not
Yeah.
going to depend on volunteers and trainees, which a lot of other organisations do, if we're going to actually use skilled and qualified therapists, it costs money, and that funding just isn't there. So we've developed our model to make sure that we have our own income streams that come from the mainstream work that we do. That's one of the main areas, alongside charitable giving, so that we are more robust as an organisation. And it's a model that tries to solve a problem, really, of how can communities support the mental health of people who are economically disadvantaged and very vulnerable when the statutory services are just not there. We are trying to find a new way of doing things and then to grow that, so scaling up. And we opened our a new therapy centre in Hastings this year, so that was our first sort of like reaching out into other communities, and we hope to do more of that in the future. So I'd been through a process of adopting very good clinical systems elsewhere, and I came to BTC and I was, really quite worried about the systems because it was a spreadsheet here, Word document here, and lots of cut and pasting and things not being very in control. And at the time it was during the pandemic, and so we were having to start being able to work more remotely, and we adopted some sort of makeshift arrangements with cloud-based services that were not fit for purpose. And we also didn't have very good reporting capabilities because of our systems being the way they were. So there were loads of good reasons why we needed to improve what we did. Fundraising, making sure we could evidence the effectiveness of what we were doing, GDPR, reporting internally, and putting ourselves in a position where we could scale up, because the way we were working was so inefficient that we just couldn't do it with the staff. We couldn't increase what we were doing with the staff we had. So working with Pragmatiq and developing this amazing Dynamics CRM, but making it fit for work as a clinical system, really did answer all of our needs. What we found with Dynamics is that we could have our booking system, our client records, our reporting functions, and in the future we would be able to also introduce other parts of our admin, which we have since done. So we started out with it just being our sort of clinical record system. Then we introduced our booking system. So that then was held within Dynamics. And then we have the most recent development is bringing our onboarding into Dynamics as well. And what we could see at the very beginning when we started having conversations with providers of Dynamics, including others, not just Pragmatiq, we did speak to some others, was that this could do everything we needed now and everything we could foresee in the future, including fundraising, loads of things we haven't even thought about yet, but we know it's got more potential still as and when we're able to invest. We did do quite a rigorous procurement process, because this was a big investment for us, and there's no getting away from the fact that most charities are going to be a bit frightened by making that kind of an investment, and especially if they're seeing it in the short term, they'll think it's too much. But we had to take a long view and believe in the long-term cost effectiveness of it. And with Pragmatiq, there was definitely a very clear understanding from the beginning of how charities work and what our priorities might be, working with mental health in particular. And then there was and Pragmatiq were always very real, upfront and realistic about quite how much work would be involved. You need to feel you're building a trusting relationship, which we did feel with Pragmatiq, and that's definitely been true. Our experience has been really very, very positive one of being able to trust the organisation, but also work through any difficulties that arise, because they do. There'll be slight misunderstandings at times, and to know that we work through those together in a really respectful way is very important to us. In the year 2022, we increased our turnaround of referrals, the time it takes us to turn around referrals, by 100%.
Wow.
So it went from something like 16 days from the point when somebody has their assessment to when we are able to make them an offer of therapy to 8 days as the average. Wow. So that's a massive improvement. And I put that largely down to our improved systems. So the tailored dynamic system that we have, knowing what we needed to do and then saying to Pragmatiq, look, this is the problem, how do we solve it? And then finding solutions that really worked has been absolutely key to us improving our efficiency. And the knock-on effect for clients is they come in crisis, they want to get seen for therapy, and it happens in half the time it used to. And then another area that I think we've really benefited from and will do more of is the way that we measure our effectiveness in terms of, the therapy we're providing. So we were able, we've used customer voice for a lot of that. So we used to have rather hodgepodge sort of ways of getting feedback from clients. It was never joined up. It wasn't very easy to report on. But now, using customer voice, we have very clear reporting. One thing we were able to do was to integrate a thing called Recall, which is recovering quality of life. It's a measurement scale that the NHS developed, and we got the license to use that measure to measure wellbeing of our clients before and after therapy, and you can use it in the interim points as well. So now we can run that out of customer voice and have some excellent reporting in the future based on those outcome measures. It's very important for us to see what we're doing well, what we're not doing so well, what we need to improve, but it's also very important for our funders that they can see evidence of where their money is going and how it's changing lives.